Hi, I'm Natalie, and today I'm going to be sharing the news story related to the heart titled Doctors Develop AI Stethoscope That Can Detect Major Heart Conditions in 15 Seconds. So, a little bit of background on the topic. The stethoscope was invented in 1816 by a French physician. The original stethoscope, however, has boundaries in hearing subtle heart sounds. Now, this can also be attributed to the professional that is using the stethoscope. But the AI-powered stethoscope could be a potential advancement for diagnosing heart conditions like these hard-to-hear heart sounds. The AI stethoscope was trialed at the Imperial College of Health NHS Trust with 12,000 patients. Now, of these 12,000, 200 came from general practitioner surgeries, and they presented with symptoms of shortness of breath and fatigue. Some key stakeholders and individuals that might benefit from this news story are, again, the Imperial College Health NHS Trust, researchers at the Imperial College, EcoHealth, the British Heart Foundation, and the National Institution of Health and Care Research. This is the device itself. So as you can see, the monitor is about the size of a playing card. It's placed on the patient's chest to record the ECG, which is going to look at the electrical signals of the heart. And then the microphone will record the sound of blood flowing through the heart, particularly looking at the movement of the valves and how well they are working. The information is then going to be sent over to the cloud, where it's analyzed by AI algorithms that are already in place. So some main points that I was able to take away is that an AI stethoscope can diagnose various conditions like heart valve disease, abnormal heart rhythms, and heart failure in a very remarkable amount of time of just 15 seconds. Some data I was able to pull is that patients were twice as likely to receive an accurate heart failure diagnosis and 3 times more likely to be diagnosed with atrial fibrillation, which is very important clinically. We want our patients to be always diagnosed accurately so that we can get them the treatment they need. An AI stethoscope had significantly higher diagnostic accuracy compared to that traditional stethoscope, again, which should definitely be noted in a clinical setting. Some expert opinions to turn to that are stressing the importance of that early diagnosis for success of treatment. So the earlier we can get that diagnosis, the better that we can treat our patients. This is very important to get the earlier diagnosis anywhere, but it was also stressed in the primary care setting specifically. And then the overall analysis that I took away is that AI stethoscopes are strongly recommended for symptomatic patients and should not act as routine screenings. So this is implying that if a non-symptomatic patient came in for this, it could be a potential risk that the stethoscope picks up a false positive and causes distress in that matter. So we only want people that are symptomatic. And then further studies and trials are, of course, wanted to determine the device's capacity and just overall accuracy. Like I said, potential limitations could be that risk of a false positive for the patient, and the actual patients that were used may not be representative of a diverse population. And this is presenting potential bias. So we would want possibly more people, a larger study in the future that have various different symptoms, more than we were able to see in this new study. So the overall impact is that the new device was presented to the medical professionals at the world's largest heart conference. So it is far enough along that it is being talked about and being sought out by medical professionals. This could save lives and money. So getting that earlier diagnosis and the treatment that patients need could save someone's life, and the money of in the accuracy where you're going to multiple doctor appointments, and this can kind of save you from getting that answer right away. So this is overall just going to initiate the potential for AI diagnostics in medical care, which I see becoming very prominent. So while more research is needed, it can be a very exciting thing to see how AI can help us in the medical world.